Let's continue with visual diagnosis inspection. Today we discuss about swelling of joints of the forelimbs and edema of forelimbs. First, we discuss on the swelling of the joints of the forelimbs. A swelling of the joints of the forelimbs is always due to painful obstruction or B syndrome, especially that deriving from dampness. In chronic conditions, dampness develops into phlegm, which obstructs the joints and causes further swelling and bone deformities. In adults, especially women, it is very common for painful obstruction syndrome and swelling of the joints of the forelimbs to occur against a background of blood deficiency. If the joints are red and hot to touch, in addition to being swollen, it indicates retention of damp heat. So first, we discuss about the damp painful obstruction or the B syndrome. Swelling and pain of joints, a feeling of heaviness of the limbs and the body. In case of damp heat, in addition to the above symptoms, the joints would be also red and hot to touch. If it's a case of phlegm in the joints, there would be long-term chronic swelling and deformities of joints, osteophytes, a feeling of heaviness of the limbs and body, sputum in the throat, a feeling of oppression of the chest, swollen tongue with sticky coating, and slippery pulse. Now let's go to edema of the forelimbs. Edema is generally caused by young deficiency of the lung, spleen, or kidneys, or by retention of dampness. When edema affects the legs, it is due to either to a spleen yang deficiency, a kidney yang deficiency, or a combination of the two. In some cases, edema may also be due to an accumulation of dampness in the legs that prevents the proper transformation of fluids. In this case, besides showing edema, the legs will look generally puffy. Edema caused by a deficiency of yang or an accumulation of dampness shows pitting. That is, the skin indents and changes color when pressure is applied. In few cases, edema may be due to stagnation of qi and blood in the legs, in which case it is non-pitting. Here is a diagram showing the two different types of edema of the legs, the pitting and non-pitting edema. Pitting edema is due to spleen yang deficiency, kidney yang deficiency, and dampness. Whereas non-pitting edema is due to qi or blood stagnation. So let's discuss further the edema of the forelimbs. There are two types of edema. One is called water edema or Zhuizhong, and the other is qi edema or Qizhong. Water edema is due to yang deficiency and is always pitting edema. That is, the skin pits and changes color on pressure. Qi edema is due to either qi stagnation or dampness, and the skin does not pit nor does it change color on pressure. Another classification is yang and yin edema. The former is the full type and is due to invasion of wind and dampness of toxic heat, whereas the latter is empty type and is due to a deficiency of spleen and or kidney yang. In yin edema, there is marked pitting on pressure, whereas in yang edema, there is little or no pitting. From a Western medicine perspective, absence of pitting indicates edema due to hypothyroidism. When observing the limbs for edema, we should always palpate the edematous area, and check whether or not the skin pits on palpation. If pressing the skin with the thumb leaves a dent that takes a long time to spring back, this indicates water edema or edema due to the retention of fluids. If pressing the skin with the thumb forms no dent, this indicates chi edema, which is due to chi stagnation or dampness. True edema is generally due to a deficient yang. The fluids is unable to transform, transport, and excrete properly, accumulate in the space between the skin and the muscles. Yang deficiency is the most common cause of edema of the limbs. Lung yang deficiency affects primarily the hands, kidney yang deficiency primarily the feet, and spleen yang deficiency both. Edema of the four limbs may also derive from retention of dampness in the muscles, which may be associated with cold or with heat. Chi stagnation affecting the muscles may also cause edema of the four limbs, in which case it will be non-pitting type. In the elderly, edema of the limbs may also derive from chi deficiency and blood stasis. Finally, acute edema of the hands and face may be due to invasion of lungs by wind water, which is a type of wind cold. So, treating edema of the limbs, we may use REN 12, REN 9, REN 5, LI 10, lung 7, spleen 9, and bladder 22. To summarize, edema of the limbs may be due to lung yang deficiency, which will manifest. It could also be due to kidney yang deficiency, which will manifest with edema of the feet. Third, it could be due to spleen yang deficiency, which will manifest with edema of the four limbs. Or fourth, it could be due to dampness, which will manifest with edema of the four limbs. Or it could also be due to chi stagnation, which will manifest with a non-pitting edema of the four limbs. And sixth, it could be due to invasion of the lungs by wind water. Here we have acute edema of the hands. Let's discuss further the empty type patterns. First, we have here the spleen yang deficiency. Pitting edema of the limbs and abdomen. This will show pitting edema of the limbs and abdomen, cold limbs, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, and feeling cold. There is a pale and wet tongue and a deep, weak pulse. Treating with acupuncture, we could use REN 12, stomach 36, spleen 6, bladder 20, and we could also use moxa. Second, we have here kidney yang deficiency. This will manifest with pitting edema of the ankles and legs, weak knees, lower back ache, cold knees, feeling cold, a bright white complexion, tiredness, lassitude, abundant clear urination, urination at night, impotence, decreased libido, pale and wet tongue in a deep, weak pulse. Treatment with acupuncture, we could use kidney 3, REN 4, bladder 23, kidney 7, and do 4. And we could also use moxa. Now let's move on to the full patterns. First, we have here dampness. This will manifest with swelling of legs and ankles, ache, swelling, redness, and heat of joints, hot limbs, sticky yellow tongue coating, slippery rapid pulse, and other symptoms and signs depend on the organ involved. Treatment with acupuncture, we could use REN 12, REN 9, spleen 9, REN 5, and bladder 22. Next here we have chi stagnation. This is a non-pitting edema of the limbs with a feeling of distension of the limbs. The skin springs back on pressing the swollen area. In acupuncture, we could use GB34 and liver 3. Next, we have lung qi deficiency. This, this will cause a pitting edema of the hands and face, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating, dislike of speaking, bright white complexion, propensity to catching colds, tiredness, dislike of cold, a pale tongue, and an empty pulse. Next up, we have cold dampness. This will cause swelling of legs and ankles, feeling of heaviness of the limbs, cold limbs, aches in the joints, feeling cold, sticky white tongue coating, and slippery, slow pulse. Next, we have chi and blood stasis. Here we will see edema of the limbs, cold hands and feet, numbness of the limbs, muscular weakness, purple color of hands and or feet, tiredness, poor appetite, loose stools, weak voice, a bluish purple tongue, and a choppy pulse. Next, we have wind water invading the lungs. Here we will see a sudden swelling of the eyes, face, and hands that gradually spreads to the whole body, a bright shiny complexion, scanty and pale urination, aversion to wind, there's fever, cough, slight breathlessness, sticky white tongue coating, a floating slippery pulse. This is an acute type of edema, and this pattern is a type of external wind cold. Here we have a case history of a 51-year-old man who had been suffering from edema of the legs and abdomen, breathlessness, night sweating, and inability to lie down for 8 months. A Western diagnosis revealed that he suffered from congestive cardiac failure. He also experienced a feeling of heat in the head and a feeling of throbbing of the head. From a Western diagnostic point of view, this was due to hypertension. Interrogation revealed that he also experienced a feeling of pressure in the right eye in the morning, tinnitus, thirst, and a tendency to diarrhea. He was slightly overweight and his body shape was the fire type. That is, he had a relatively round body shape, round head, and small hands and feet. However, the fire type should walk briskly and talk fast, whereas this patient walked and talked rather slowly. His complexion was dull pale. His tongue was very slightly pale and very slightly red on the sides, with a deep hard crack and a sticky white tongue coating. His pulse was weak on both rear positions, but especially on the right, weak on the right front position and slippery on the front position. As for the diagnosis, the contradiction between the patient's fire body type, body shape, and his slow walk and talk indicates straight away a potential problem in the fire element and the heart. This is confirmed by the presence of the deep hard crack on the tongue, and this usually indicates severe emotional problems, but not in the case for this patient. Or if it's not an emotional problem, it could be a heart problem. The heart problem is also confirmed by the slippery quality of the heart position, which is all the more striking considering the weak quality of most of the other pulses. when only the heart pulse is slippery, especially in its lateral or medial aspects. It often indicates the possibility of heart disease in a Western sense. Thus, in this patient, the contradiction between the body type and his walking and talking, the pulse and the tongue, all clearly indicate the possibility of an actual heart disease, which was, of course, confirmed by the Western diagnosis. In terms of patterns, there is a deficiency of spleen and kidney yang, manifested by the tinnitus, the tendency to diarrhea, and weak pulse on both rear positions, with water overflowing to the heart, which is manifested by the edema, breathlessness, and inability to lie down. In addition to these two patterns, there is also liver yang rising, stemming from the kidney deficiency, manifesting with a feeling of heat and throbbing of the head, thirst, pressure in the eye, and red sides of the tongue. Thank you for your attention.